The Department of Education may announce next month the opening of school year 2020-2021. Joint Task Force Coronavirus Shield admits that imposing drastic measures against physical distancing violators is a huge challenge. Researchers at the University of Cambridge identify 3 distinct strains of COVID-19. Mobile freezers set up in hospitals after reported unclaimed cadavers of COVID-19 death cases. Localized testing commenced in some parts of the country. 97-year-old great-grandmother in Brazil recovers from coronavirus. Good evening. Parents and students may expect next month the Department of Education to announce the possible adjustment of the opening of school year 2020 to 2021. Joan Nano tells us why.
Majority of the students in the country could not finish school year 2019 to 2020 after the national government imposed enhanced community quarantine, which includes a massive class suspension. Local governments in provinces have also implemented either quarantine or lockdown orders. All these in a bid to slow the spread of coronavirus that has hit various parts of the country. Several students have opted to join the Department of Education's online teaching classes.
Ang ginawa ng DepEd, nagbigay sila ng link sa group chat ng mga parents sa school. Ngayon ang ginagawa namin, pinuntahan naman yung link na binigay ng DepEd. Lahat ng subject doon, pinapasok nila. Tapos ngayon nabubuksan ng mga bata. Doon nila nire-review yun.
As of now, DepEd has yet to decide on the possible adjustment on enrollment and school opening for the next school year as they await the IATF's recommendation. In an interview in Get It Straight with Danielle Razon today, DepEd Undersecretary Ann Sevilla explained that it's a huge challenge for them to implement physical distancing in schools as millions of students are expected to enroll for the upcoming school year.
Ang pinaka-challenge sa atin, Kuya Daniel, is definitely yung classroom is 1:50 ang design. Ibig sabihin sa isang classroom may 50 na tao. Sa probinsya, mas swerte dahil mas konti. Pero yung estado ng ating public health emergency, it does not allow the mass gathering. And dyan ho, talagang unang-una, ang eskwela ang nakasalalay dyan.
DepEd has come up with several plans such as the full implementation of alternative delivery program or home and online schooling if the opening of classes will be adjusted. In a separate interview, Education Secretary Leonor Briones clarified DepEd is only postponing the conduct of graduation rites and not cancelling amid the present health emergency. This is to comply with the government's prohibition of mass gatherings. Joan Nano, UNTV News and Rescue. We serve the people, we give glory to God.
The Interagency Task Force for the Management of Emerging Infectious Diseases warns local government units on distributing assistance to ineligible beneficiaries. Rosalie Cos explains why.
Once proved that a local government unit has given financial assistance to a person not qualified to be a beneficiary of the Social Amelioration Program, that LGU should refund the national government. The Interagency Task Force for the Management of Emerging Infectious Diseases also warns the local chief executive will face complaints over this matter. If there's no appropriate liquidation report on the distributed assistance, no social amelioration fund will be given to that locality for the next month.
And that does not preclude government from filing any criminal, civil, or administrative cases against the LGU official.
The government has allocated a 100 billion peso financial assistance fund for this month that will benefit the sectors most affected by the enhanced community quarantine. Around 50% of that amount has been released by the Department of Social Welfare and Development. That includes 323 million pesos for the more than 14,000 beneficiaries that belong to transport groups in the National Capital Region. The 43 billion pesos transferred by the DSWD to the local government units and 800 million pesos for the Bangsamoro Autonomous Region in Muslim Mindanao is also part of that fund. The DSWD has also been working on resolving issues concerning the timely distribution of assistance such as security, the reconciliation of lists of beneficiaries, and logistical challenges.
Bagamat may mga pagsubok na ating kinakaharap Atin itong agarang tinutugunan upang ang serbisyo ay mapagpapahatid ng tulong ay hindi maantala.
In Pasig City, all families in need who are not on the DSWD list will be covered by the city local government. In Manila City, the LGU distributed a 1,000 peso cash assistance for each family from the City Amelioration Crisis Assistance Fund. Rosa Licoz, UNTV, News and Rescue. We serve the people, we give glory to God.
The government may limit the implementation of enhanced community quarantine only in areas with ineffective measures against COVID-19. Dante Amento tells us why.
The government could implement selective quarantine. This is if the enhanced community quarantine protocols are properly followed. The parameters being considered include the conduct of mass testing for COVID-19, increase of recovery rate, decrease of the number of deaths, and the increase of the capacity of local health care units. The continuous strengthening of quarantine-controlled checkpoints must also be done.
Nagbibigay ng direktiba si Secretary Lorenzana na lalong higpitan ang papapatupad ng mga checkpoints at ng ECQ sa Metro Manila dahil sa nakaraang pagsuway sa ating mga implementasyon ng lockdown.
According to National Task Force Against COVID-19 Chief Implementer Secretary Carlito Galvez Jr., communities or LGUs with good performance in their fight against COVID-19 may lift the quarantine order in their areas. But the community or enhanced community quarantine will remain in localities with ineffective measures against the virus. But the IATF clarifies this still depends on the President's decision.
But we have to show, no, with accuracy how these mechanisms will operate and how it will be to the advantage of our health, no, our safety, security, our economic, no, and social dimensions.
Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Interagency Task Force for the Management of Emerging Infectious Diseases says the Department of Health will come up with guidelines for the handling and sharing of personal information of COVID-19 patients. Harleen Delgado tells us why.
The Department of Health will issue a set of guidelines for the sharing of personal information of COVID-19 patients. This after the Interagency Task Force Against COVID-19 announced it is now requiring the disclosure of personal information relating to positive COVID-19 cases to enhance the government's contact tracing efforts. According to Cabinet Secretary Carlo Nograles, the DOH will be the safekeeper of the patient's information.
Kailangan po talaga yung mga pasyente mag-disclose ng accurate and truthful information sa Department of Health. And kung hindi po mag-reveal, ay mapapahamak po siya. Yan po yung nakasulat sa batas.
Under the Mandatory Reporting of Notifiable Diseases Act, non-cooperation of persons or entities identified as having the notifiable disease is considered a violation of the law, as well as the unauthorized disclosure of private and confidential information pertaining to a patient's medical condition. Violators may face a penalty of 20,000 to 50,000 pesos or imprisonment of not less than 1 month up to 6 months. The license to practice of any medical professional or the civil service eligibility of a public servant who will be found to have violated the law may be suspended or revoked. The Cabinet Secretary emphasized they are not telling the patients to disclose their personal information to the public, but to the DOH and other authorized agencies.
So, even if may sharing po ng information, lahat ng public authorities, lahat ng public officials should be mindful of the provisions on data privacy.
Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, Joint Task Force Coronavirus Shield admits that implementing physical distancing protocols in Metro Manila is almost a Herculean task. Lea Ilagan details why.
A large number of people go to the marketplaces, banks, and grocery stores despite the implementation of enhanced community quarantine in Luzon. Task Force CV Shield Commander, Police Lieutenant General Guillermo Eleazar said, in the program Get It Straight with Daniel Razon, they cannot simply impose drastic measures against violators because these people are allowed to go out to buy foods and other essentials.
Binabalanse po natin yan. Madali i-recommend na wag silang palabasin. Kaso po, they are the ones availing the basic services. Ang ating binabalanse dito, ito yung pagkain na bibili naman nila at lalabas sila. So, binabalanse po, talagang babantayan natin and then papakiusapan na pumila rin sila.
He says their coordination with local governments and concerned government agencies continues on setting up measures in order to avoid congestion in markets, banks, and other essential public areas.
Yung pag-restrict ng mga number of hours na pupunta sila sa mga grocery store is hindi makakatulong dahil kung liliitan mo yung window of them, yung time for them to avail of the services, lalo magkukumpul-kumpul. Might as well i-extend natin siya ng oras pero mag-staggered sila. And that will be, yun po yung ating i-coordinate sa ating mga establishments through our LGUs.
Eleazar appeals to the public to be responsible and play their part in this battle by obeying physical distancing protocols for one.
Alisin natin yung pagiging matigas ng ulo. Lahat tayo po nagsasakripisyo. Sana man lang itong ginagawa natin paghihirap ay sakripisyo, makabit natin yung ating objective. At para sa ilan-ilan na siya magiging dahilan para hindi natin ma-attain yung ating objective sa kabila ng sakripisyo ng ito, makonsensya naman po kayo.
Eleazar adds the PNP are still active in arresting curfew violators. As of today, 105,000 individuals who disobeyed curfew ordinances have been accosted, more than 25,000 of which have been slapped with cases. Lea Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
The provincial government of Laguna recommends implementing strict regulations for market goers among local government units. Meanwhile, Iloilo City steps up its response against the COVID-19 threat, while Butuan City brings the market nearer to resident homes. Sherwin Kulubong tells us why.
Every town and city in Laguna must implement strict regulations for the public when going to marketplaces. This is the recommendation of the provincial government to the LGUs in the province. Despite the Laguna-wide lockdown, residents can still be seen congesting markets and grocery stores because of their need to buy food and other necessities. But Christopher Sanji, the PIO chief of Laguna, says the government continues to call on residents to limit going outdoors, observe social distancing, and wear facial masks to avoid contracting the deadly coronavirus. In Butuan City, on the other hand, a mobile market has been launched which will roll on the roads of 86 barangays from 6 a.m. to 6 p.m. The moving market is seen to alleviate the residents' worries of going outdoors and getting infected with the COVID-19 virus. Vegetables, eggs, grocery items, and other food products are available at the mobile market. For the schedules, just visit Butuan City PIO's Facebook page or call 0909-502-2850. Meanwhile, Iloilo City began its mass testing for COVID-19 today. Suspect and probable cases will be the first to undergo swabbing. Medical frontliners with close contact with coronavirus patients will also be tested. Medical technologists in Western Visayas Medical Center will conduct the test round the clock, accommodating 100 to 300 specimens a day. The results are expected to come out in 2 to 3 days. This move is done in cooperation with the national government, the Health Department, and the Regional Institute for Tropical Medicine. Sherwin Kulubong, UNTV, News and Rescue. We serve the people. We give glory to God.
A group of researchers in the UK dig more into the novel coronavirus that has spread around the globe. They explain the COVID-19 variants falls under types A, B, and C. Jovic Burmas has the story.
Scientists and researchers in University of Cambridge say they have identified 3 distinct strains of COVID-19. According to Dr. Peter Forster, a geneticist in the university, his team traced the origins of the pandemic by analyzing 160 genomes from human patients. They found out that the strain in Wuhan, the hardest hit city in China and believed to be where the novel coronavirus originated, mutated from an earlier version.
We use and have developed software methods to reconstruct prehistoric molecules which no longer exist. And if you apply that, you find out that a location in the network, which we call type A, is the original type that would have infected humans. Then it would mutated and change into a type B. This type B was then the first genome to be picked up in Wuhan when the disease became apparent.
Dr. Peter Forster, the lead author of the study, further explained that a type B, which is mostly found in East Asia, is a mutated version of type A. European nations are currently being hit largely by type C, a mutation of type B.
Now, the C type is not found in the early phase of the outbreak in China. It is found outside. For example, it's well represented in Singapore.
The geneticist further notes that instrumental in this is the GIZA database. This is run by a German ministry and people from across the world. A mathematical network algorithm was used to visualize all the plausible trees of the coronavirus simultaneously. Dr. Forster says they think this is one of the first times these techniques have been used to trace the infection routes of a coronavirus like COVID-19. Jovic Burmas, UNTV News and Rescue. We serve the people. We give glory to God.
And now here's the updated count of the coronavirus cases around the world. The COVID-19 pandemic as of today has reached a total of 1,859,011 confirmed cases in 185 countries. The fast-spreading disease has so far claimed 114,979 lives, while 435,074 patients across the globe have recovered from the deadly disease. The United States of America still tops among the countries with the most confirmed cases, with a total of 557,590 cases. America also the most death cases with 22,109, mostly in New York. Spain is second in the tally with 169,496 confirmed cases, but with 64,727 recoveries. Italy is the third most hit country with 100,056,363 persons. France has less than 1/4 of United States cases now with 133,672. Germany's recovery cases are almost half of its 127,854 confirmed cases. The United Kingdom is now the 6th most affected country in the world, with over 3,000 more than China's 83,135 confirmed cases. Meanwhile, in the Western Pacific region, from 6th place last week, the Philippines moves 1 place upward. It follows China, South Korea, Japan, and Australia among the countries and territories in the region with most coronavirus cases, with 4,932. The Department of Health places mobile freezers in hospitals after reported unclaimed cadavers or patients who had died from coronavirus. Meanwhile, the Philippines is now the Southeast Asian country with the most number of COVID-19 confirmed cases. Aiko Miguel tells us why.
Based on the Department of Health's Memorandum Order Number 2020-0067, issued last February 3, there is a protocol for the burial of the bodies of patients who had died due to COVID-19. The cadavers should be sealed in airtight bags to prevent gas or any fluid from leaking. Those remains must be cremated provided there is consent from the patient's family. The DOH has placed mobile freezers in hospitals that treat coronavirus patterns to ensure that unclaimed cadavers would not pile up in health facilities.
Ang East Avenue Medical Center naman po ay nag-report na sila'y nakakuha na ng mobile freezer para sa mga unclaimed bodies. may COVID man o wala. Ito'y malaking tulong upang madagdagan ang limitadong capacity ng kanilang mortuary.
The DOH is in the process of finalizing the agreement between the DILG and the MMDA for the proper burial protocol of COVID-19 death cases. DOH Secretary Duque personally talked with the individual who is believed to have spread fake news on social media. The DOH is getting to the bottom of the matter.
Seryosong akusasyon po ito at prioridad ng ating pamahalaan na siguradong walang omission of information na magaganap.
DOH warns the public not to patronize or spread fake news. Meanwhile, as of 4 p.m. today, Philippines has 4,932 confirmed cases after recording 284 new positives. This makes the Philippines on top of the list of Southeast Asian countries with the highest COVID-19 cases. There are now 242 recoveries but 315 death cases in the country. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Senate Majority Leader Juan Miguel Zubiri announced yesterday his test result has turned out negative for COVID-19. Under the DOH process, a COVID-19 patient must test negative for the novel coronavirus twice before the patient is declared a recovery. Even Education Secretary Leonor Briones has tested negative from COVID-19. Based on another test conducted on her, the education chief said Health Secretary Francisco Duque III told her she is now negative for coronavirus. Meanwhile, a 4-year-old boy becomes the sixth coronavirus positive in Oriental Mindoro. The child belongs to a family in Sitio Mungos, Barangay Hagan, Bongabong Town. The boy has no travel history in another area with confirmed coronavirus cases. His parents say that the boy's fever had been recurring in the past week. He was also experiencing difficulty breathing when he was transported to the hospital. The boy is now in a better condition, according to the Provincial Health Office. 2 other children in the province had earlier tested positive for the deadly disease. 15 testing facilities across the country are ready for the COVID-19 mass testing. Some began testing today, while others will start tomorrow. Majority of these testing centers are in Metro Manila, the epicenter of the COVID-19 outbreak in the Philippines. There are 2 testing centers in Baguio City, 1 in Bicol, 2 in Visayas, and 1 in Davao. The National Task Force Against COVID-19 says this will help a lot in the fast and wider scope of targeted testing.
Doctors and medical staff of the Philippine National Police Health Service are all geared up for the deployment to the PICC quarantine area. They just await advice from the Health Department when they will begin to manage the forum tents at the Philippine International Convention Center, which has been converted to a temporary COVID-19 quarantine facility. According to PNP Chief Police General Archie Gamboa, this is part of the PNP's commitment in helping the government in its COVID-19 battle. The PICC forum tents can accommodate 294 COVID-19 patients. The government will provide aid to owners of micro, small, and medium enterprises, or MSMEs, and members of the Social Security system, according to House Speaker Alan Peter Cayetano. The lawmaker also admit that some of them find the distribution of aid to beneficiaries slow. Vincent Arboleda will tell us why.
The informal sector and low-income families will not be the only ones to receive support from the government. According to the Speaker of the House of Representatives, Congressman Alan Peter Cayetano, the government is now preparing the aid that will be given to other sectors. Speaker Cayetano has earlier revealed that next to receive aid are the owners of micro, small, and medium enterprises, or the MSMEs, as well as Social Security System or SSS members. As of the moment, no amount was announced as to how much will be given to each MSME or SSS member, as well as the total budget allocation for the program. Cayetano said that a hearing will be done tomorrow, together with other lawmakers, through video conferencing. Some lawmakers are expected to present their proposals for the economic stimulus. Meanwhile, lawmakers also find the distribution of aid to the informal sector and low-income families slow phasing.
Even si Senator Bongo, sabi niya kanina, nababagalan din siya. That's why hinihimay natin. That's why we were asking Mayor Isko kanina sa LGU side. Nung isang araw, kausap ko si Sec Bautista sa DSWD side.
However, if there are other low-income families not covered by the social amelioration package, the local government units can appeal to the DSWD for additional support.
Meron pong karapatan yung mga mayors na mag-appeal sa executive para po doon sa mga pagkukulang talaga na hindi nakikita ng DSWD.
Kung kulang sa lugar nyo, yung kapitan, i-report nyo sa mayors nyo at yung mayor or governor ipadadala sa DSWD ang listahan ng mga kulang pero kailangan i-justify na pasok sila sa programa.
Vincent Arboleda, UNTV News and Rescue. We serve the people. We give glory to God.
The Department of Health has issued an advisory to announce they will no longer use the terms patients under investigation or PUI and persons under monitoring or POM. Aiko Miguel tells us why.
COVID-19 cases will now be categorized as suspect, probable, or confirmed. In a press briefing Sunday afternoon, Health Undersecretary Maria Rosario Vergara explained the terms are based on the World Health Organization's case definition for surveillance.
Itong bagong classification ay based sa international system. Ayon na rin sa recommendation ng WHO. Inalign po natin ang lokal na sistema sa sistemang ginagamit ng iba pang bansa upang magtugma ang ating pagre-report ng mga kaso ng COVID-19 sa buong mundo.
Based on the new classification, suspect cases are individuals with influenza-like symptoms such as fever and dry cough, those with travel history to areas with COVID-19 cases, and people with exposure to a confirmed case. Suspect cases also include older adults, immunocompromised persons, pregnant women and healthcare workers, or people considered to be part of the high-risk or vulnerable population. Probable cases are suspect cases who are awaiting COVID-19 test results. Those who have not been tested or those who tested in an unaccredited testing facility. Confirmed cases are patients whose test results from accredited testing facilities turn out positive for COVID-19. The new classification of COVID-19 cases is in accordance with DOH Administrative Order No. 2020-0013. According to WHO, there is a fourth case definition, which is contact. These are people who are direct physical contacts of a probable or confirmed COVID-19 case. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The University of the Philippines Philippine General Hospital is still seeking for COVID-19 survivors to donate blood to help more COVID-19 patients survive the deadly disease. Asher Kadapan Jr. tells us why.
Doctors from the University of the Philippines Philippine General Hospital has adopted the use of plasma therapy to cure COVID-19 patients. But as of today, there are just at least 7 COVID-19 survivors who have donated blood. This number is only good for 7 coronavirus disease patients, meaning 1 blood donor can help only 1 patient through plasma therapy. UPPGH continues to call on patients who recovered from COVID-19 to signify their intention to donate blood to be used in plasma therapy to help save the lives of more patients.
Just to reassure those who survived with COVID-19 na ito po ay safe at malaki po ang pwedeng maitulong sa ating mga kababayan na lumalaban sa sakit.
COVID-19 survivors eligible to donate blood for plasma therapy should be negative from the disease for at least 2 weeks, has good physical strength, and does not have any other illnesses. Yesterday, 2 patients of UPPGH underwent plasma therapy, the first ones to undergo the process.
Maganda naman po ang resulta in the sense na walang reaction na nangyari dun sa nakuha nilang plasma. Ibig sabihin, walang rejection o hindi nagkaroon ng complication. Inaabatan namin ngayon kung ano ang mangyayari kasi we are hoping na magkaroon ng clinical improvement over the next 24 to 72 hours.
Senator Sani Angara, who has recovered from COVID-19, also took part in this endeavor by donating his blood to save another patient. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
East Avenue Medical Center releases a statement today regarding a footage circulating on social media being attributed to the hospital. EAMC explains there is no room or area of such kind in EAMC. The flooring and furnishing does not match any area in the hospital. The EAMC morgue can house only 5 bodies at a time, and the EAMC places cadavers inside body bags and placed on a stretcher as a sign of respect for the dead and not on the floor as shown on the video. Metro Manila cities have begun their own community-based localized testing. The Health Department welcomes this, noting that it will help the government in its strategy for expanded mass testing. Harleen Delgado will tell us why.
The Quezon City government started its pilot community-based testing today with 150 suspected COVID-19 residents. The city has the highest number of COVID-19 positive patients in Metro Manila, now at 764. According to the city government, those who will be checked are residents identified by the district health officers and are suspected patients with symptoms.
Hindi pwede walk-in kasi kailangan muna ng preliminary interview ng barangay at saka ng barangay health worker. Dinadala sila via ambulance, 1 patient, 1 ambulance, kasi kailangan i-practice ang social distancing.
The samples will be sent to Research Institute for Tropical Medicine, where results are expected to come out in 3 to 5 days. The city government adds they are in talks with other laboratories, including the Lung Center of the Philippines and St. Luke's Medical Center, for faster release and to reach its testing capacity target of 500 samples per day. The Philippine Red Cross is set to add 1,500 test kits to the city's current 1,300, while another 10,000 are expected to be delivered in the coming days. The city of Valenzuela was the first to conduct its localized targeted testing on Saturday for more than 20 suspected COVID-19 positive residents. The city of Manila has also started its targeted mass testing in its 6 city government hospitals, which are now capable to conduct over 200 tests a day. The city of Pasig, meanwhile, is set to begin its localized targeted mass testing. Meanwhile, Cavite Governor John Vic Remulla is also planning to test 2 million of Cavite residents. According to the governor, those who will be prioritized include the suspected COVID-19 positives, frontliners, and factory workers. The DOH welcomes the initiatives of the local governments, but hopes they will adhere with the protocols set by the department. Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Department of Environment and Natural Resources reminds the public to dispose of waste properly, especially amid the threat of coronavirus infection. Ray Pelayo reports why.
Trash may be a carrier of viruses, according to Environment Undersecretary Benny Antiporda. This is because any member of a household in a quarantine could be a carrier of the COVID-19 virus. The officials advise a solution of 10% bleach and 90% water can be combined to disinfect trash.
Ihalo nila yan para yan ang gamitin nila sa basura nila at para naman sakaling contaminated yung basura nila, hindi naman tamaan yung ating mga garbage collectors.
The DENR encourages businesses in the line of garbage collection as well as local government units to require garbage collectors to wear personal protective gears to avoid contracting any diseases. The DENR also confirms that chemicals used in disinfecting surfaces may cause damage to the environment.
What disinfectant can we use in our offices assuming na nagkaroon ng positive doon sa office? Paano namin i-disinfect, no? One solution is the UV light. But how many UV lights do we have in this country?
The DENR agrees that direct spraying of disinfectants to human is harmful, as what the World Health Organization and the Philippine Health Department say. Ray Pelayo, UNTV, News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte reappoints human rights lawyer attorney Harry Roque as the presidential spokesperson effective today. This was confirmed by outgoing presidential spokesperson Salvador Panelo, who will remain as the chief presidential legal counsel. He will continue to provide legal advice to the president on matters that require the chief executive's action. When asked what made the president decide on this, the palace official said the present crisis requires a new tack in messaging. Attorney Roque resigned from being the presidential spokesman in 2018 after he decided to run as senator during the 2019 elections. Roque withdrew from the Senate race. And now for the news abroad, here's RL Kamiya live from Takatsuka, Japan. RL, good evening.
Good evening, William. Here are the fresh stories from around the world. At least 6 people were killed on Sunday as a strong storm system swept across Mississippi and Louisiana, spinning off more than a dozen tornadoes and leaving behind a path of destruction, state and local authorities said. The storms hit on Sunday as residents across the U.S. South were under strict stay-at-home orders by the governors of Mississippi and Louisiana due to the coronavirus pandemic. All 6 fatalities were recorded in Mississippi according to the state's emergency management agency. A severe thunderstorm warning remains in place across several countries. As the tentative peace holds displaced Syrians are weighing up Grimm's options. Miguel Rey de Leon reports why.
Remain in tightly packed camps where a viral spread could be lethal, or return to homes still at risk of getting caught in renewed violence. These are the options displaced Syrians are taking stock of. Thousands of displaced Syrians have begun moving back to their homes in war-torn Idlib province despite the risk of renewed conflict. Some of them driven by fear that the new coronavirus could wreak havoc on their pokey camps near the Turkish frontier. Over the past year, about 1 million Syrians fled Idlib and its surrounding countryside in northwest Syria after Russian-backed government forces stepped up a campaign to retake the last rebel stronghold after 9 years of war. Fighting has calmed since March when Ankara agreed a ceasefire with Moscow, which has supported Damascus with heavy air power. Syria's northwest does not yet have a confirmed case of coronavirus, but doctors fear that the area's ravaged medical infrastructure and overflowing camps would quickly turn any outbreak into a humanitarian disaster. The Syrians Response Coordination Group, a Northwest Syria relief agency, said on Sunday that 103,459 Syrians have returned to towns in the Aleppo and Idlib countrysides since the ceasefire. Miguel Rey de Leon, UNTV, News and Rescue. We serve the people, we give glory to God.
A nuclear-powered carrier recently taking part in exercises with Northern European navies in Baltic Sea is now docked in France. Meanwhile, a store chain in Japan puts up a plastic barrier between customers, while a Chinese city bordering Russia steps up traffic restrictions. Kath Domaraos explains why.
France's sole aircraft carrier docked in southern France on Sunday. Authorities detected cases of the novel coronavirus aboard several days ago. 50 crew members aboard the Charles de Gaulle vessel tested positive for the new coronavirus. Parts of the ship have been put on lockdown according to the Armed Forces Ministry. A ministry statement said that 3 sailors had been evacuated by air to a military hospital in Toulon, the home port of the carrier. The aircraft carrier, which is equipped with its own intensive care facilities, has 1,760 personnel on board. Meanwhile, China's northeastern city of Suifan-he on the country's border with Russia said on Sunday it's strengthening border controls as part of measures to prevent imported coronavirus cases. The city, which lies in the northeastern province of Heilongjiang, will also step up traffic restrictions and enforce strict quarantine measures, city authorities said in a statement. The city has banned all types of gatherings and drawn up a list of businesses that must be suspended. Mainland China reported 99 new coronavirus cases on April 11, more than doubling from the previous day to reach a one-month high, showed data from China's National Health Commission. Just 2 out of the 99 cases were locally transmitted. And in Japan, a major convenience store chain has installed plastic curtains at cash register counters as a precautionary measure to help block transmission of the new coronavirus. The move is part of the store chain's safety measures after Prime Minister Shinzo Abe declared a state of emergency in Tokyo and 6 other prefectures last week. The plastic barriers were hung from the ceiling between customers and staff and were rolled out at 150 stores mainly in Tokyo. The company is considering expanding their measures to other local stores. Kat Dumaraos, UNTV News and Rescue. We serve the people, we give glory to God.
Bands, music, dances, and lights all shout out salute to COVID-19 frontliners. Police officers, Air Force personnel, and the lights and sounds industry went out of their way to pay tribute to the first responders. Marisol Abogadil has this story.
In Madrid, police officers paid tribute to health workers on Sunday by playing music for them outside a hospital in a moment of relief from the coronavirus emergency. A police band played iconic songs such as I Will Survive in front of the Gregorio Maranon Hospital. Health workers happily danced and clapped, holding flowers and signs after almost a month of lockdown in Spain. Tough lockdown measures have helped bring down a spiraling death rate that reached its peak in early April, and the new deaths reported on Saturday were the lowest in 19 days, while the increase of confirmed cases has roughly halved from a week ago. In Las Vegas, the U.S. Air Force's Thunderbirds showed their solidarity with frontline workers fighting the pandemic with a flyby over Las Vegas on Saturday. The United States Air Force Air Demonstration Squadron, known as Thunderbirds, flew over the Nevada city for the healthcare workers. The Thunderbirds say it is an honor to fly for the healthcare workers and first responders. Philippines. At exactly 7 p.m. Sunday, the lights and sounds industry lit their white lights towards the sky in celebration and salute to frontliners battling COVID-19 and helping patients fight the disease. Participants in Bulacan, Cebu, Naga City, and other parts of the country made sure not to violate the social distancing protocol and curfew ordinances. Through this event, the industry has raised a total of over 1 million pesos, which will be used to procure personal protective equipment to be donated to frontline medical workers battling COVID-19, according to organizers. Marisol Abogadil, UNTV, News and Rescue. We serve the people. We give glory to God.
And those are the reasons behind the stories abroad. Back to you, William.
Thank you, R.L. Kamiya, reporting live from Takatsuka, Japan. When a Brazilian great-grandmother was hospitalized on April 1st with coronavirus symptoms, few could have thought she would have survived the deadly virus. But on Sunday, the coronavirus patient was pushed in a wheelchair out of Sao Paulo's Villanova Star Hospital. Nina Armilio tells us why.
A loud applause echoed in this hall of the Villanova Star Hospital as Gina Del Coleto could finally leave the health facility. The doctors, nurses, and health workers who care for her and other patients hit by the novel coronavirus are inspired by her recuperation despite her age. The unexpected recovery of the 97-year-old is a huge ray of hope in the Latin American country worst hit by the outbreak. The great-grandmother mother lives alone in the port city of Santos, Regidor São Luís, and is the sole survivor of an Italian family comprising 11 siblings. The coronavirus has laid bare a stretched public health system and exposed fierce political debate over how to best tackle the virus spread and prop up the country's economy. As of today, Brazil has over 22,000 confirmed cases with more than 1,000 deaths. Nino Armilio, UNTV News and Rescue. We serve the people. We give glory to God.
Our kasangbahay, we are at a time when the country is under a state of health emergency. The cooperation of all Filipinos is imperative to avoid the deadly virus. We are calling on everyone to be calm.
And most importantly, let us join together in prayer for our country and for the whole world to survive this crisis. You may join us in our daily UNTV community prayer at these hours as flashed on your screens. Those are the reasons behind the news. I am William Theo. We serve the people. We give glory to God.
And I am Victor Cosare. Because we need to know, we will always ask why. Good evening.